Good afternoon, everyone. Thank you for being with us today. To get us started, I'll give an overview of the data for today. We have 41 new cases to report. There are 56 people hospitalized. 5 people are in the intensive care unit across the state, and those 5 people are on a ventilator in the ICUs as well. Sadly, we have 2 new COVID-19 associated fatalities to report for today. Both of these people were in their 80s. Our sympathies and prayers are certainly with the families of these 2 Rhode Islanders who have passed away, as well as all of those who have lost loved ones during this time. So as the governor mentioned, we have updates on visitation with our healthcare facilities, and I'm going to walk us through them. Last month, the Rhode Island Department of Health provided guidance to nursing homes and assisted living facilities on how to develop safe visitation plans. We asked those facilities to work on a comprehensive plan, take the steps they needed to put in place the safeguards that would be important. And as facilities continued to work on their plans, RIDO allowed facilities to start communal dining and communal activities about 2 weeks ago within nursing homes and assisted living as a way to begin the process and to test out the safeguards that they're working on and putting in place. Then last week, 4 facilities that had not submitted their own visitation plans to RIDO, we provided a standard basic plan for safe visitation so that all nursing homes and assisted living facilities have a basic plan to follow if they don't already have their more comprehensive visitation plan, which we are continuing to encourage all facilities to submit to us. With those steps in place, as the governor just shared, as of today, facilities are authorized to start scheduling short visits with guests to see their loved ones in nursing homes and assisted living facilities. We are authorizing these scheduled visits to start occurring. We encourage you to reach out to your facility and work with them as each facility will engage in the process to get this going. The majority of facilities have done their part and are ready to get started, engaging with you and scheduling visits and moving forward. There's a small group that wants to take a little bit of time, a few days or a week or so, to advance towards that visitation. It's either because they have had recent cases, which is something we are working closely with facilities to respond to, that they may need to readjust if they have cases, clusters of cases, or because they need a little more time to implement their safe visitation plans effectively. Although this is just a small group that may have their timing slightly different, the basic infection control measures that are required to be in place for nursing homes and assisted living facilities are overall consistent and follow as such. Here are some examples. We are requiring that visits are scheduled in advance, as has been shared, so please make sure that that's an important first step in calling the facilities. The visits will be kept short as we get this started in 30-minute increments and be able to work from there. Facilities must actively screen everyone for symptoms of COVID-19 before they enter the building. Facilities will be keeping a daily log with names and contact information for all visitors as well. We are also encouraging outdoor visits, as that is a preferred approach to support facilities in doing. Regardless of the location of the visit within the facilities, visitors must maintain a 6-foot distance from the residents they are visiting, as well as from staff, and all visitors must wear a cloth face covering in order to enter the facility or engage in the visitation. If a facility has a new case, the Rhode Island Department of Health will be on it immediately, work closely with the facility as we have been doing, and visitation could be halted again. So we are working closely with continuing to monitor that. We are also lifting the restriction that didn't allow barbers and hairdressers to go to nursing homes and assisted living facility. There's a clear understanding that the emotional well-being of the residents, both in appearance and in how they're feeling and engaging with others, is a key part to this overall recovery. We recognize that this has been an enormously challenging time for nursing homes and assisted living facilities, for the residents, the staff who love them, and the administrators as well. And in many ways, more is being asked of all of them now as well. So I want to thank all the staff and the facility administrators for their partnership over the last several months, their diligence in doing the best to keep residents safe, and their patience and flexibility. I also want to thank the residents and their family members who have also had a very challenging time through this. Thank you in advance for your patience as we work to balance patient and staff safety with your desire to see your loved ones. Halting visitation, as the governor shared, was a necessary step to protect residents, but it was also an extremely hard decision and not something that we ever want to have to do again in such a broad way. Another change that I will highlight is related to the hospital visitation, as has been shared. In early March, the Rhode Island Department of Health developed a 3-tiered visitation scheme for hospitals to follow. Since then, hospitals have been operating at the strictest level, which prohibited visitation except for some very specific scenarios. As of today, we are allowing hospitals to move to level 2, which allows for visitation during limited visiting hours. Those limited hours will vary by hospital. However, similar to the nursing homes and assisted living facility, there are some consistent requirements across all of the hospitals. Screening for symptoms will be happening at designated entrances. Face cloth coverings will be required at all times. Visitors will not be allowed to congregate in areas like waiting rooms and gift shops. This expectation is that people will go, is that people will go directly to the patient's room and remain there unless they need to step out because of care being delivered to the patient. These are just a few of the examples of the requirements that will be in place. I want to thank all the hospitals throughout the state for their partnership on this approach to visitation. With the support of the Hospital Association of Rhode Island, which we also thank, the hospitals have worked together to move in a united front forward with these steps. They have been phenomenal partners throughout this response. So again, to the staff and leadership of each and every hospital throughout this state, thank you. We're enormously grateful for all you have done and continue to do. And in the same way, I want to thank nursing home and assisted living facility residents and their families, and be able to thank hospital patients and their families for your patience and for your commitment to your loved ones as we work towards taking the next step in allowing for that engagement. Patient safety, staff safety, and the need for patients to see their loved ones are all very important. We appreciate you working with us and understanding as we have taken this cautious, measured approach